You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I'm Kathy Biasi, your host, and I'm an holistic nutritionist and a professional cancer coach. There is an undeniable patient-led push for an integrative healthcare system. As we as patients learn more and begin to take on more responsibility for our own health, there seems to be a growing number of medical doctors who are opening up to the possibility of more encompassing care that addresses the emotional, spiritual, as well as the physical parts of our being. And to talk about this changing landscape, our guest today is Dr. Cammy Benton. Dr. Benton is a functional medicine trained MD who owns Benton Integrative Medicine, an holistic direct primary care office. She has studied integrative modalities since graduating medical school in 2000 to include nutrition, homeopathy, ayurveda, and functional medicine. In recent years, she is exploring more mind, body, and spirit paths to apply to her medical practice. Also, after the traumatic years of the pandemic, it became obvious to her the need to reevaluate the current medical system and to work on creating parallel medical systems. She is working with a team to create a mini hospital called Compass Integrative Health that has a fully integrative spin to help patients when they are their sickest to have the best of all medicine. Her hobbies are learning more about everything and finding about more rabbit holes, dancing, enjoying time with her beloved Kyle Hall, and eating dinner at home with her 4 children between all the sports activities. And her goal is to try and make the world a better place in every way so she can honor her path that God is providing for her. We talk about, as mentioned above, the changing landscape of the medical system and how allopathic medicine is failing the patient, why it needs to be changed, why giving space for the patient's story is critical for healing, and what Dr. Benton's vision for creating integrative hospitals is. Please stay tuned with us. We will be back in just a few minutes to talk with Dr. Benton.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back, everybody. Today's show has been recorded, so no opportunity for calling in. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on those locations. Dr. Benton, welcome to the show.
Thank you so much for having me.
Oh, it's just a pleasure. When we talk about medicine and the changing landscape of medicine, you're one that has been like in the thick of it, up to your knees in the changing landscape. What would you say? I know this could be a very long answer, which is absolutely fine. What helped you transition from allopathic care into a functional medicine direction?
Yes, long answer.
That's absolutely fine. We have lots of time.
So I would say it kind of started back in residency. I graduated medical school in 2000, and I quickly in residency got the feeling that patients weren't feeling heard. And I didn't feel heard. So I would have patients come to me with kind of complex issues that was outside of the scope of my training. And when I would go to the attendings to ask for like help on this, they would be like, oh, they read too much Dr. Google. They're not really having that problem. And I had a really hard time. Like, for instance, one of the ladies, she had like a lot of fungal infections, like underneath her arms and her groin, like in her tongue. She had the thrush on her tongue, recurring yeast infections. And I looked at her like, well, you are covered in fungus. And she's like, I've got systemic candida. And that word is considered it's just considered quackery in allopathic medicine. And so I went to my attendings and they're like, oh, no. It's just all in her head. And she just has to have cancer or AIDS to have that. So I go back to this woman covered in fungal infections and I'm like, they just don't know how to treat you. So I don't know what to do. Sorry. And that was just the beginning of my wow, we don't know how to do everything in medicine, and it's okay. We're not supposed to know everything, but I did not like being taught to dismiss the patients and kind of making fun of their really legitimate concerns. So that was sort of the beginning of it. And then when I was driving on my first year of practice down this road going to work, I was like, oh God, this is it in medicine. I've learned how to give this pill, which causes this side effect. And then I treat that side effect with that pill and this side effect with that pill. And I was like, I just felt like had become a pill pusher. And I was like, there's got to be more to this than medicine. And then I found a homeopath actually giving a talk, and which fascinated me. I'm like, wow, there's a whole other form of medicine. And I grew up without going to the doctor. I grew up in the very country areas, not really good access to medical care because we didn't have health insurance, and everything, of course, is expensive and far away from where we were. So I had this romantic idea of medicine that I was not seeing while practicing. And I was like, but homeopathy was just too different. So I struggled with seeing how that naturopath that was doing the homeopathy was able to help people that I couldn't help. And I was sending people to specialists everywhere that were coming back on antidepressants. And it's because their medical issues were just in their head. And I just did not feel good about that. And so then when my children and myself had various, I call them medical misadventures, and I can get into that if you want, but medical misadventures, which I could write a book about all this, quite frankly. And then I'm like, wait a second. So again, Western medicine, allopathic medicine was kind of blowing us off or not knowing what to do or promising a lifetime of medications. I was like, I can't do this. And so on top of my busy practice and, my 3 children, I had to learn functional medicine, some homeopathy, nutrition to help recover their health, as well as my own. So through that, then I started studying formally at the Institute of Functional Medicine, and then A4M, which is another organization, and started practicing my practice. And honestly, it revived my love and my faith in what I thought was medicine. And then the last 3 years, of course, the pandemic was enough to cement my questioning of how allopathic medicine is being practiced, and at least in the United States. It proved to me that we have to get creative on the ground with where we're heading, because there's so much regulatory capture, quite frankly, and we have to do things differently. So even beyond functional medicine, I've gone more into a spiritual energy medicine of trying to figure out. Even then, I felt like I could help people that could not be helped with regular medicine. But then even within that, some of those people had serious spiritual traumas that they could not get past. And then in discovering that, once I was able to help guide them either through me or through another energy worker or spiritual worker or something like that, then they were able to start getting better. So then I was like, wow, there's this whole other world of medicine out there, even then, that I didn't know. It's been a blessing to be able to start exploring during the pandemic.
Do you think that allopathic medicine, when we talk about it, the same situations always seem to come up? And I don't like to hammer allopathic doctors. But do you think it's a dismissive system, or a fundamental lack of knowledge?
It's complicated. I think that for some of your listeners that have really done a lot of the research, there's a big shift in the early 1900s when Rockefeller came in, and that's when the pharmaceutical companies came out, and a lot of good things has come out of that. I think that's nothing's all good and nothing's all bad. Like a lot of amazing discoveries have been made within the pharmaceutical companies, but unfortunately, what happened was, in order to promote this very lucrative system, they really dismissed all the integrative providers and criminalized them, quite frankly. And I think that's where they started going wrong. And they created the us against them when first, I'm an integrative doctor. So I think there's good things about so many different systems. And why would we not want to bring the best of everything into play? But I think to create a system where you are really primarily utilizing the more lucrative methods of treatment, you have to convince those doctors that that's the only way to do it. From what I could tell in all my years of kind of questioning sort of the status quo, like for me, I've gone down so many rabbit holes in so many different areas of medicine and politics and business and everything. And I'm like, why is it that doctors are so reluctant to open their hearts to these integrative modalities, right? And because I think most doctors are inherently good people, and I think they really do care about their patients, but somewhere there's been a lot of mantra making and medicine of what you need to do. And I think that there's a lot of training. I think I would say, I think by nature of most doctors, like we are overachievers, we like to get our A, we like to be the favorite student. And I think there's some natural human nature of this, of we want to be good rule followers. And when someone else is making the rules, we want to be accepted by them, and we don't want to be a quack. So we're trained really early on. Those who question things are unusual or dangerous, or they're a quack. And God forbid we should be a quack, because, we're good students. We're smart. We don't want to be like that. And I think there's a lot of that psychology that goes on. And I think by most doctors, not intentionally. I don't think most of them are like, oh, I'm going to convince these people. However, the marketing is very intentional, that is coming at the highest of the high in the pharmaceutical industry, that before they come up with a product, when they see it's going to be successful, they start marketing that product years ahead of time, marketing that disease that formerly did not have a prescription for it. So they start marketing, oh, guess what is coming up these days? And so that marketing comes really early. So then when they come and save you with that pill, then everyone's really excited about it. They don't even realize that they've been being prepared for that moment. And doctors either. And I can tell you, I kind of stopped going to allopathic trainings a couple of years ago, because I couldn't take it anymore. Because really, when you go there and at the common conferences, the title is the latest pharmaceuticals in diabetes, the latest pharmaceuticals in osteoporosis, the latest pharmaceuticals in this and that. And in those lectures, you're hearing all this exciting news about these different treatments. You hear very little about risks, and you hear regularly nutrition is dismissed, natural remedies are dismissed, or even like, I remember at the last conference, even they're talking about gluten sensitive people. They're like, oh, there's no one with gluten sensitivity. It's celiac disease or nothing. And so they're telling 1,000 physicians in one sitting, kind of halfway making fun of people who are having gluten sensitivity, or people who don't react well to the flu vaccine. They're making fun of them en masse. And that has a psychological impact, a ripple really that goes down. So I think it's a mix of lack of knowledge, because most doctors I know don't know the actual studies. I know they just know that they've been taught at these. They're like, because we're busy, like we have children, we have kids that are in sports, and we're busy, like working way too many hours. Most of us that work full time are working a lot of hours. And so the idea of putting in even more effort on top of that to really dig into the truth is not usually inviting for most doctors. And so for them to recognize, once I started going down the different rabbit holes and recognizing, wow, there's a whole other level of truth deep down beyond what we're kind of presented. And I had to go through my own phases of grieving, really, in medicine, where I went through sadness and anger and disbelief, until I kind of came to the other side of like, okay, it's not all bad, it's not all good. But that's a hard thing for physicians to go through when they, in their mind, they're like, I'm here doing a good job and I'm here to do the best I can do. And they think they are, when there's this whole other reality that they're not even aware of. And and then to undo that on top requires a lot of work. I mean, when I went through functional medicine training, I had 3 kids under like 5 and, studying on top of my 55-hour-a-week job. But I had the incentive because my children were suffering in their health. So I had to find a solution. So I had the extra incentive that maybe if your family's healthy, they're doing fine, you don't have that same incentive, or you don't have a sick family member that you're trying to figure out. It's just easy. So I think it's a mix of some dismissiveness, lack of training. And I do believe the training is very biased, even though they try to say it's not biased, it's very biased.
And I totally understand that. Now, when it comes then to a shift we see it now. We see how busy is the functional medicine school, how many more practitioners are trying to grasp other things. There are 2 things that stand out to me. One, the change in medicine may be up to the patient and may be a patient-led. So getting patients with the kind of what the ethos of this show is, getting them to ask questions, getting them not to just accept. So I see a patient-led progress. The other thing is that all doctors don't have to go back to school to become a functional medicine doctor, but they can have in their Rolodex qualified practitioners that can help to, get a fully encompassed area of health. Do you see both of these avenues? Do you see one more than the other, or is this just wishful thinking?
No, I think that the patients are definitely creating a shift because of the demand, right? So like as soon as I started studying functional medicine or any kind of integrative medicine, actually once people heard that I was actually open to different ideas, that they just wanted to be able to bounce the ideas that they've already studied and learned off of someone and be respected. That alone, I had people like driving a long time to come see me. They just want to be heard and respected, right? So then even in my small town, even as that started getting around, at first the doctors were like, she doing over there? Then when they started seeing the benefits of it, they're like, how'd you learn that? Then they were like curious. So it created in that smaller town a demand because the patients were asking for me just for that purpose, right? So then and that's why I'm in Charlotte, North Carolina, and we're really exploding in integrative medicine providers of all kinds, which is amazing. And the more we have, which means there's more patient demand, right? And so that's shifting the entire landscape of medicine, I think, in my area. And it's coming from purely patient demand. People drive from all over the country, really, to come to see a good provider. And so that's going to shift, I think. And doctors, I have more other doctors now referring patients to me because I also don't keep their patients. Like I encourage patients to go back to their primary care providers so we can create a teamwork. And I let them know, I'm like, they don't know, but if we can show them your improvements, then that will spark their mind to say, wow, who else I can send this patient there too, and they'll come back, and that patient will come back to me. So I really try to send patients back to them to inspire their providers, but also it creates a nice referral network. So that's definitely has been happening over the last many years as we've grown in our area. And this is happening across the country. So yeah, it's exciting methods of having the growth and explosion and the shift of the landscape is really patient driven.
Yeah, and I like this conversation because we're not bashing here. I mean, you are so right. Doctors need to stay in their lane. They need to know medicine. They need to know that path. But I think where the broadening, especially with what I see, is that they are now maybe saying, well, maybe you should go talk to a nutritionist, or maybe, and slowly but surely, as you say, as the results are coming back, the mind is broadening. The other issue that I want you to maybe talk about is it's built into the system of teaching with doctors. Do we need to change the actual teaching system from ground zero to start incorporating at least the ideas?
Yes. So I will say when, I went to med school, like I started in 1996, so it's been a while. And I suspect it's not much different, although there are a couple medical schools I understand that's starting to incorporate in some functional medicine ideas. But if there's a doctor out there listening, I hope they hear this part, is that in the first 2 years of medical school, we learn, biochemistry, embryology, pathophysiology, like you learn all the basic sciences. And I remembered at that time being told, don't worry, yes, it's kind of like details that you don't really need to really remember. Like once you pass the first boards after the second year, we'll get to the fun stuff, which is like learning how to treat and prescribe. You can forget all the stuff from the first 2 years of medical school. Well, as soon as I started studying functional medicine, it was all based upon the first 2 years of medical school. Mm-hmm. But there is that disconnect because doctors, if you look up Wikipedia, I don't want to give this really too much traction, but if you read about functional medicine there, it's horrible. It's like, if you were to read that, it was like pseudoscience and snake oil and all this kind of stuff. But really, it is based in the basic sciences of medicine, of the human body. And so it's so valuable. So if I get a doctor like to hear that and remember, they probably have heard the same thing. Oh, once you get to third year med school, this is when you get to the fun. You can forget all the stuff you learned. And it was, and when I was learning functional medicine, I'm like, oh, if I could just go back to the first 2 years of medical school and see how this really applies to health, that would shift everything. If they could actually really continue, if all those attendings could go learn functional medicine and see how these first years of medical school directly impact how we see a patient, how we help a patient heal. Because, for those of you who don't know, like our skin and our gut lining were once the same inside when we were an embryo in our mom's bellies, right? It was the same level. And then so the skin goes to the outside and the gut stays on the inside. So a lot of people who have gut issues also have skin issues. So like if you have a lot of eczema and psoriasis, if you work on healing the gut, the skin issues get better, if not completely, like they improve at least, right? So those little things, even embryology matters in functional medicine. So it's very based in real science, real health. So yes, I think that'd be great if we could shift the education, because like the thing is, I use prescriptions too all the time. I'm not anti-pharmaceuticals. Mm-hmm. A lot of us still use prescriptions, and it's a nice little coverage while we work on underlying roots of health. And some people also, they just progress long enough into their disease. It's kind of hard to stop all medicines. And again, and thank God for all the advances that pharmaceutical companies have made. So just so you know, I'm not against pharmaceuticals, but I am against using it first line. Uh-huh. Unless you just have to, or unless it's like things we do well in medicine is trauma and acute medicine, acute care. But even that's kind of questionable in my opinion. But the trauma, we have amazing technology, but honestly, if you see what they're doing in Europe and in Asia, they really are quite advanced. And when you look at the American, as in the United States, I know you guys are Canadian American, you are Americans too, but in the United States, if you compare our healthcare system to the rest of the world, we rank really quite low. I mean, we're number one for infant and maternal mortality in all the developed nations. We ranked 34th for quality of care for chronic disease states. We ranked 33rd in the world for longevity by age 5. We rank at the bottom of modern nations, with longevity in adolescence. I mean, it is really a serious issue here in this country that a lot of doctors think, oh, we're still the best in the world, which we're really not. Mm-hmm. And it's an ugly reality that we're having to face, especially looking at, just the pandemic and what happened here. Of course, we all have our different theories about this, but it impacted our outcomes dramatically. Of the shift away from using our mind and our eyes and our hands and our intuition to treat patients. That was really taken away from us because they want us to follow algorithms regardless of who's in front of us. And that's a very dangerous way that our medicine has gone, that we need to shift back to getting our hands on the patient. But it seems like they're moving away from that further because we're about to be replaced by AI.
And that's another show altogether, isn't it? Everybody, we're going to take a quick break. We'll be back in just a few minutes to continue our conversation.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Cathy Biasi.
Welcome back, everybody. We're talking with Dr. Cammy Benton. Dr. Benton, we touched briefly upon people coming and having time with you and space to talk about how they feel. Why is that missing in medicine? How does that being heard positively affect our health?
Well, right now, at least in the United States, patients are seen every 10 to 15 minutes on average in a corporate setting. And within that time, we're also going through the quality of care metrics and checking boxes. And half the times, if you can actually listen to the patient, a lot of times the patient will tell you their diagnosis. Like 80% of the time, I feel like they're like, did you know I had this stressful event that happened right before this? And so then you can get into the emotion of their illness and the spirituality of their illness, but you just don't have time in a setting. So I have my own practice because I couldn't take it anymore. I could not do medicine in 10 minutes. And so I have a direct primary care practice where I have like 45 minutes to an hour with every patient. And it just amazes me, like once you give them time, like patients are so empowered to be able to give their ideas, and it makes them part of the team for their own health versus in the regular setting where you just, all right, here's your pill, see you back in 3 months. Here's your pill, see you back in 3 months. And it's just disempowering because you're just having to do what the doctor tells you. There's no time to really navigate your own health. And even when patients have surgeries, I tell them, have the surgeon pray with you, slow down, say, slow down. I want to pray with the team, because what that does, that brings them into that moment of really, oh, this patient's paying attention right now. And it gets them out of their habit of their rut of going through patient to patient to patient. So really engaging your provider. And I would say to patients too, it's like, if you find you're not being heard, you need to say, hey, I feel like I'm not being heard. Sometimes that doctor, they're not meaning to do that. They're just trying to survive. They're just trying to like stay on track, and usually they're 30, 40 minutes behind, and they're getting in trouble for being behind, but then triple booked anyway. And so this has, in a curious way and a compassionate way, you can actually ask the doctor, hey, can you slow down for me? Because I'm not being heard. You'll get a different outcome if you do that.
I totally agree. When you ask just one, what would you call intellectual question in your interview or in your consultation with your doctor, they are stopped. I've seen it so many times. I've had so many people tell me, I asked this one question and then we had a whole different conversation. And that's what I so want to put across to everybody is get questions in your mind. Don't be afraid to, it's your body. It's your body, and you've got to really tend to it yourself. Now, we just got through a pandemic. Everybody was shifted in some way, shape, or form. How did it shift you as a practitioner?
Well, I had already, like I said, kind of broken away from the system a little bit before this happened. And I was so full of gratitude that I had my own practice. In the United States, at least, it was very much controlled by algorithms that, I can go, this could be a whole other show. That I think were not the right intentions that were being put out there. And I think a lot of people, they created so much fear, and a lot of people lived in fear. And I think a lot of their policies actually supported driving more fear rather than safety. Because what we did, instead of going out and exercising, seeing the sun, getting the vitamin D, and being connected, they literally disconnected us at the deepest levels, like even the 6-foot distance. When you measure our energy, you measure the EKG in your heart, you measure the EEG in your brain, you can measure our body's energy up to 6 feet out. So it's interesting that they chose 6 feet for you to stay away from other people. Sorry about that. So I measure people 6 feet away. And so then literally we're even energetically being disconnected from other people, right? So it was such an isolating time. But then on top of that, I watched people being refused care. So locally, we treated over 1,100 patients. Hold on one second. Sorry, that was unexpected. Sorry about that.
No worries.
Anyway, where was I? Okay, so we were isolated on the deepest level, on a personal level, and even people, when they had COVID inside their own house, they would go to their own room and they were isolated and afraid. But then in the middle of this, we had, doctors attacking other doctors. I mean, it became such a really traumatic experience for me, within medicine. Even within the integrative community, there was a big split of, this narrative or pro that narrative. And instead of actually really caring about patients, it became quite a vicious thing. So I even had a classmate of mine from medical school wish death upon the unvaccinated. I support people getting whatever vaccine they want. I'm all about informed consent and your choice. But this was an experimental vaccine. And so there's a lot of people who really did not feel comfortable taking an experimental vaccine, especially now when you look at the statistics for survival now versus what we were hearing of the news at the time. And so when I was seeing really doctors being this aggressive, like really wishing death, refusing care, and we started seeing one-time patients. So we treated over 1,100 patients that were not ours. They were all refused care from their primary cares, from urgent cares, from ERs. And so then you're like, how can this happen in a pandemic? And quite frankly, I got in trouble for treating COVID patients. I had to I got reported by 2 pharmacists for prescribing early treatment for COVID. A pro-vaccine activist from California reported me. And so we're having to do, I'm still lucky I have my license. Other doctors lost their licenses for treating COVID patients. And I've had to do some punishment CME, continuing education for treating COVID patients. It's like literally was a crazy issue. So what that did, it gave me a whole other level of understanding of what the medical system has become and what is my role. And I realized I can't really fight such a big system. And honestly, that was like the anger in me and that frustration in me was tearing me apart. So I was like, what can I do differently? And so we decided, let's build our own medical system. It's time for us to create a parallel system. And so we created this concept. It's called Compass Integrative Health. You can actually look it up, compassintegrativehealth.com. And it's a nonprofit and for-profit project that we're wanting to build an integrative medical system. We're going to start off first with an integrative urgent care, and then hopefully build it up to the inpatient system. And what we want to do is thank God for medicines that we have. So we use antibiotics when you need, or IV fluids when you need. But then we also have homeopathy. We have herbals. We have the acupuncturist. We have the chiropractor. And because right now we have wellness centers across the country popping up left and right. But what about when you're sick? When you're really sick, how can we keep people out of the hospital? Or even when you get in the hospital, how can we optimize their outcomes? So right now in regular hospitals, you're not allowed to use IV vitamin C. Well, that seemed to be a critical thing for so many people. High dose vitamin D, high dose vitamin C, but that's considered taboo in the allopathic medicine circle, even though there's plenty of studies to support it. And worst case scenario, it causes little harm. Right. So why not bring in these integrative modalities, sound frequency healing? And I had heard you mention earlier about even lighting in the hospitals. When you deal with fluorescent lighting, people get migraines, people get brain fog. Even the lighting of a room matters. And we were even thinking about things like, when someone's in the ICU, can we not create a wall that goes up to roll them outside so they get some fresh air when they're really sick? But right now we have them all clumped into these rooms. There's all these harsh chemicals and sprays and cleaners. that are, like creating problems with people, like with asthma. People with asthma, they don't do well with those chemicals, those fragrances in the air. And the air is just like heavy with the smell. Everyone knows the smell of the hospital.
Mm-hmm.
No one likes it, right? So why not create a different environment? And so we get to use the best of everything. We get to use the best of Western medicine, but we also get to use the best of Chinese medicine and acupuncture, sound frequency healing, lighting, having people's preferred spiritual advisors, whether it be a priest, a pastor, a shaman, whatever, and have us really collaborate and have like their shaman or their priest or whoever on the team and understand the spiritual aspect of someone's healing. People died alone during this pandemic. Mm-hmm. People died alone and they could not even touch their family member, right? And to me, that was women had their babies taken from them at birth if they tested positive. When the baby does the best when they touch the mom, they get the antibodies from the breast milk. And we deprived women of a normal delivery during this time. There are so many crimes against humanity, to me, that increase death, the lack of early treatment, the pushing of a treatment like remdesivir that we knew at the beginning of the pandemic. The study was already there that showed high risk of serious harms, kidney failure, lung edema, death with remdesivir. Yet that was the treatment of choice that was started in the United States. And Fauci had direct ties to that. So when you see that regulatory capture happening and you watch people dying, you're like, it's time for us to make a difference, but we can't fight that system. Let's just start our own new. And so now people across the country, it's beautiful to watch. There are people of all kinds across the country doing new things for our earth, for our communities, for our world, for our countries. And these are really the heroes of what's happening now, the shift in the timeline of that heavily corrupted system, that system that is really so contaminated by greed, right? So now we have these people saying, okay, I'm not fighting, we're creating. And now we're getting to do things out of love, connection. So there are people out there teaching people how to turn their yards into gardens, right? To have renewable food sources. How to become less dependent on the system. How to become less dependent on doctors. Like how can we, so I see groups of people around here learning herbal medicine and homeopathy and really taking their health in their own hands. And it's really quite beautiful and empowering. And then as we are shifting this medical system, if we can also, like our goal too, is to help heal nurses and therapists and doctors from the old corporate system. So we plan to even bring in some good mind-body therapies for everyone who comes into the system to undo their traumas. Because even though we don't like it, a lot of times we don't realize what parts that we've taken on as normal. And so we've got to do everything from scratch, right? But we're doing it on every level of society right now. They're doing it in education, in farming, in medicine, in just everything. Is honestly, I'm so excited to be a time. This is time to be alive right now, and this shift in history, because we can remember the traumas, we can remember the hard things, but out of those hard things is what creates this new sense of urgency for creation, for connection, because we were so disconnected on every level during this pandemic. I'm so excited. So if anyone wants to donate to Compass Integrative Health, like we do have donations that are there. I have had to take a little backseat while I'm dealing with the medical board issues, but that's all right, because we're doing it and we're going to get to the other side, and we're going to show them that we are not going anywhere. Like the patients are really demanding something new and better after this 3 years. And I'm full of gratitude for them showing their greed, because now people who were not aware of it before, they're aware of it now. So they've really helped to shift that toxic energy. It's really helped to shift people into a new sense of urgency for the sake of our children, for the sake of our future, because we have to shift. We have to go in another direction, because this current direction is destructive.
Is there a structure, an existing structure that you're working from, or are you still in the building phase, the ideology phase?
Yeah, we're still, we're in the raising money phase, because it's going to be a lot. Well, like I said, we'll probably, the original plan was like, let's just open up a hospital. But due to it is they have laws that protect bigger companies, bigger corporations, and makes it hard to open up an actual hospital. So they've created laws to protect themselves. So we're using legal help, and this is what we're raising money for right now, to get lawyers involved to help us find the ins and outs of, how can we get away with this? Because right now they have a thing called certificate of need, and for an actual hospital, and you have to get approval from the government to build an actual hospital, and they are directly tied to the bigger corporations that can actually make it difficult on us. So there's like layers of the stuff that I've discovered. It's like, I'm like, oh, let's build a hospital. I'm like, oh, that's a big project. And then I'm like, we can do it. But now I'm saying, oh yeah, it's a big project. So I'm having to step down, like, it's in God's timing, not my timing.
Well, is there an online presence that can it be an online type of a hospital? So I know you can't do acute care, obviously.
Right.
But can you offer something online, or is that already in place?
Well, no, it's like we're still in the planning phase of it. Right. Like I said, we're probably going to start with a local integrative hospital with some telemedicine. We're probably going to do some telemedicine for the urgent care type things. So that way we actually have an integrative approach to acute care issues. But then, like I said, once we get past the integrative urgent care, the next phase would be then to do more inpatient care, like emergency room, inpatient care. And then we also want to have like a biohacking sort of lab to help that's going to help to also fund the hospital. Because that's the thing is, like, for this hospital is different in the United States because we're so insurance based. But the reality is that most people can't afford most of the insurances anyway, and our healthcare is so expensive. So what we're trying to do right now, the research right now, is how can we create a sustainable hospital without using Medicare, Medicaid, because if we accept the government funding, we have to follow the rules.
Right.
Anyway, right. So right now we're working with people. So we're in the deep planning phase of finding the people, getting the donations to at least get the hospital built, and the investors. And we already have our investor capital person that we're going to be working with for the investments. And then, so we got to raise the money first, we're looking for like things like crowd health is like a crowdsource kind of way of raising money. Like there's Samaritan's Ministries. Basically, these are co-op insurances. So you pay like a monthly fee to it. And then, like, let's say if you need surgery, then they'll crowdsource all that money and pay for your surgery. That's how we're getting this creative sources of sort of money to pay people's services, but then also having the nonprofit end to help lower income people. Because again, I was lower income growing up, and I don't want this to be a place for the elite or just the wealthy. So we're going to have the nonprofit arm so we can target minorities and people with domestic violence or just at-risk people at all. We want to make sure that they are able to all get in with equal care as much as possible. And then also, if there are insurances, we're trying to discover those insurances that don't have the same requirements as Medicare. Because again, if you take Medicare, then you're forced to do things. I'd be forced to do things I disagree with. And because I think it's meant to be a good system, but there are some definite downfalls that I want to be able to have the choice of saying, no, I don't want the COVID vaccine for myself. But if I take Medicare, I have to take the COVID vaccine to be able to provide care, for instance. And that's not going anywhere anytime soon, I think. So
maybe a flex plan of insurance. So you're looking for flex dollars, that sort of thing. That's what we have here. And that's how I'm allowed to, patients can bill me because a lot of them are flex care. So I see that coming. If people want to find out more about you, the hospital, to donate, where should they be looking?
Well, to donate, definitely compassintegrativehealth.com. Is that landing page. Again, it's in its infancy, really, and I'm in the process of, we need donations to get more legal help, because honestly, that's the biggest thing for us right now is the legal help to get around the certificate of need. And then Benton Integrative Medicine is my website for the direct primary care to let people know what we offer. And but right now, I'm actually in the process of really trying to create community. And community can be local community. We have community across the country of people working together with ideas. Because again, we want to be able to work together. And ideally, like whatever we do for the Compass Integrative Health, we truly are, like, I want to share the blueprints. Like, it's not for me. This is for the community, built by the community. And if we can actually share the information that we've learned to other people across the country, then we help expedite this type of new earth medicine that is really we're building across the country and Canada, because we have to do it differently. And I would thankfully, Mexico has a lot more open-minded health, opportunities than the United States does. So I know a lot of people who are going down to Mexico for their treatment. In spite of what the media says, the patients are having a different experience. And what can we learn from other countries too? So if we have people from other countries, they're like, hey, this is how we do it here, or we already have an integrative system here. Reach out to me because I'd love to learn how it was done and to not have to do the same mistake twice. So let's learn from each other. So reach out to me, and I'd love to create a bigger community of people to have these ideas, because this is the community on a bigger level. Even though I'm going to be building it locally, this is really important for our world, is to share this everywhere, this idea everywhere. I have no sense of competition. Like, if someone steals this idea from me, have at it. We all need this across the country. If someone makes a chain of loving, compassionate, collaborative, integrative care for sick people, I'll be in heaven.
Mm-hmm. The wave is building. We have in Canada, Impact Medicine. It's a book that was written by another guest on our show. Same idea, patient-led, patient-pushing, practitioners jumping on board. You can see the wave is building, and I congratulate you for all that you do. This show could have been 2 hours long. We still have so many things we could have talked about. But thank you so much for joining us. I wish you all the best in your endeavors.
Thank you for having me. God bless you.
Everybody, we will talk to you next week on The Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.